All right, I'm here at RANZCOG 18 with former AMA President Michael Gannon and also ex-president of RANZCOG. He's given an interesting talk to in a trainee session about, medical workforce issues, a little bit about politics. I'd love for you to touch on some of the things that you spoke about in terms first of what's happening in the medical workforce pipeline.
Well, the brief was to talk about training, and I think it's very important that trainees and their training supervisors think about the college's mission. The college's mission is to provide excellent women's health care, and part of that is to refocus on generalism, to refocus so that the specialist gynecologists and obstetricians in the community are able to work in rural areas, in outer metropolitan areas, in areas of greatest need. So it's really important to focus on that, on producing obstetrician gynecologists that have the abilities to look after all women, no matter what their means and no matter where they live.
You spoke about some threats as well to the future of O&G, the workforce and the profession in general, as you see it. What were some of those threats?
Well, it seems every few years we have a new maternity services framework which seeks to diminish access of women in their pregnancies to doctors. It's extremely important that the doctors work in collaboration with midwives and other health professionals. But the best practice care of women in the 21st century involves the cooperation of anaesthetists, paediatricians, pathologists, psychiatrists, surgeons. Any move to reduce the involvement of doctors in the care of women during their pregnancy should be resisted by the community and should be resisted by the College of O&G.
You spoke about APRA and you also spoke about pelvic mesh. Could you touch on what you said about that?
Well, I think one of the things I had to say about the Senate mesh inquiry is that the Commission on Safety and Quality in Healthcare has made some rules that don't have a great deal of clinical input. Now, my personal regret about the process is that we're going to get a whole new group of victims. There is no question that a proportion of women were injured by either inappropriate application of these surgical techniques or complications from surgical techniques. The point I made is that it's most unfortunate that mid-urethral slings, a well-validated, very effective and very safe operation for stress urinary incontinence, has been bundled up in the response to the problems with transvaginal mesh for pelvic organ prolapse. So we're in a dangerous area where non-elected bureaucratic bodies start dictating to doctors about what they can and can't do. Hopefully there's lessons out of the mesh disaster about doctors' relationships with industry and about the regulation of new techniques. But it's also important that clinical decision making is not impaired.
You've just finished your term at the AMA. How did you find that being in Canberra? What lessons did you learn? And how did you manage, I guess, that kind of conflict between being a clinician and being a politician, so to speak?
Yeah, I was a politician for a period of time, and it had enormous demands, especially for myself living in Perth. So I spent a lot of time on planes and needed to develop some strategies and techniques to look after my health and to get the job done. It was a 50, 60, 70 hour a week job in addition to my clinical responsibilities. It required great patience and understanding from my young family, and it required great patience and understanding from my colleagues who would often cover me. And I will always be grateful to my patients for understanding that I wasn't always able to be there for them. So it was a wonderful personal experience for me. I'm proud of what I achieved. The AMA is an amazing organisation that helps make this country a better place. It was an honour to serve.
What were some of the victories for you, or some of the moments that you think, yeah, we did a good thing?
Well, I think that it's really important that the AMA is in there every day advocating for the health system that makes Australians lead happier, healthier and more productive lives. So day on day we would refer to the importance of health prevention. We've got a long way to go. Day on day we would advocate for better funding of general practice. Again, we've got a long way to go. Trying to bring government, the bureaucracy, other stakeholders to understand the importance of our blended public and private system. So hopefully the bits of work that I was involved in, like reforms to private health insurance, like looking at better public hospital funding, like understanding how the different parts of the health system knit together, I hope that those bits of work that weren't finished come to fruition in coming months.
Yeah, what are some of the unfinished business that you sort of regret that you didn't sort of get to draw a line under before you went?
Well, we've just had a presentation today talking about the role of the Medical Board and AHPRA. One project that I would have loved to have delivered was to see the exemption for treating doctors from providing mandatory reports to the regulator on doctors with mental health or drug and alcohol problems for the WA exemption to be rolled out nationwide. It's very difficult to get 8 state and territory health ministers to agree on anything. That project has a way to go, but it's so important that the people looking after patients have the ability to pay attention to their own health.
It's obviously a very different perspective from the top, of the AMA as opposed to where you may have come from before, within your own specialty. What are some of the things you learned about the challenges to the health system from that very high vantage point?
I guess there were things I already had a fair idea about, but we know that the bureaucracy and government are big, cumbersome beasts to move. So to get serious changes in health policy is difficult. I called many times as AMA president to get the ideology out of healthcare. Healthcare is too important to be a plaything of party politics, and at the extremes of ideology are people who don't see the value of health prevention initiatives and see the value of Medicare and public hospitals. At the other extreme, you see people who don't understand how highly effective, how efficient the private system is. Ideology doesn't belong in the care of patients. We should look at what works and try and deliver the best possible care we can to patients.
And what's next for you, Dr. Gannon?
Well, I've retreated back to public and private practice in Perth. I never stopped practicing, but I've been able to increase my workload. I'm involved with one of the medical indemnity providers, and people are still interested in what I have to say. I'm certainly not running for Wentworth.
We'll wait and see what happens in Swan, hey?